Hi, and welcome to our THT Navigation Health Series, Part 1. Thank you for joining us today. We're launching a new series to help our members navigate their health plans. Whether you have the Signature Plan or the Advantage Plan, you'll be able to learn about the avenues of care available to you outside of your yearly checkups and get updates on our THT Health. Each webinar will be less than 10 minutes and hosted by our website once finished. If you're not able to join us live, you can certainly catch us with us on a weekly basis. A calendar of topics will be available on the site for you to see. And with that, let's get started and dive in. There are many sources where information is shared. Some of it is not accurate. Here are a couple of misconceptions that we want to clear up for you. So one of the biggest questions that I've gotten recently are, did my deductible reset? So if you did not change your PPO plan to the Advantage Plan, meaning that you chose the Signature Plan during the September 2021 open enrollment, your deductible, which is traditionally a calendar year, is going to carry over from January 1st of 21 through September 30th of 2022. However, if you move from the PPO plan into the Advantage Plan, your deductible reset on October 1st, 2021. By law, making a change from a PPO into a non-PPO plan resets the deductible. The deductible on this plan is $1,500 for an individual or $3,000 for two or more dependents. This means you, the member, are responsible for all medical costs until the deductible amount is met. One question that I'm always asked is, why is pharmacy always changing? We are all aware healthcare is continually evolving, and as a plan, we need to evolve too. We have a new pharmacy partner, Surpass Rx. We have a dedicated THT Health pharmacy team that is here to help members with prescription costs that may be unaffordable due to unforeseen changes in the healthcare industry. This team's available to you 24/7 by phone at 844-622-1797. And as a reminder, when you fill a prescription, please double check that the pharmacist is using your new ID card. You will know the correct card is being used if it has a UMR and a THT logo on the card. And one other misconception that I think people are confused about is, who are we calling when we call? We are all still THT Health, and you are still talking with us when you reach out. All our partners are an extension of THT Health and are experts in the delivery of the benefits they offer. We work together with our partners on a weekly basis for training and cohesiveness for our members. If you call our number and speak to a member of the THT UMR team or the THT Surpass Rx team, you are actually speaking with THT Health. We all are a team together working toward providing the best member service experience for you. I know that one source of stress for people is when they're sick is not knowing where to go. This is normal. We all need to see a provider from time to time outside of our normal checkups. The question becomes, where is the best place to get the best care for my needs? In a true emergency, call 911 or go to your nearest emergency room. If you can seek non-emergent care, here are some avenues to consider that are included with your health plan. So many people aren't aware that there's a quick answer to some of your healthcare questions that don't cost you anything. Maybe your concern can't wait until you see a doctor. You can talk to our registered nurses day or night on our 24/7 nurses hotline. You can get help with deciding whether to visit a doctor or an urgent care center, understanding your symptoms, managing chronic conditions, or learning about treatment options and medical procedures. So let's quickly talk about some scenarios. You started a new medication and missed a dose or two. What should you do? Your child's been suffering with cold-like symptoms and has had a temperature under 101 for 2 or 3 days. What should you do? Or have you been breastfeeding a baby and he or she still seems hungry? How do I know if he or she's getting enough breast milk? This resource is an excellent way to make sure you are getting an expert opinion on your healthcare needs. Remember, there's no cost to call the health line, the nurse. There's another option for 24/7 treatment for conditions that do not need immediate medical intervention. You've been used to using telehealth in the past. We have a new partner, Now Clinic Telehealth. This service is available for anyone insured on your plan at any age and in any state. This is a great option for those who are traveling during breaks or in the summer, and it also is helpful for a dependent who might be out of state. Now Clinic's providers can prescribe appropriate non-controlled medications and have them sent to your nearest in-network pharmacy should you need them. So how to help you determine when to use telehealth? We have a full list of symptoms and conditions on our website in the FAQ section under telehealth. So be sure and download the new Now Clinic app. Make sure to set up your account. And one thing to remember, where prior we had virtual visits for any telehealth visit, you have to use Now Clinic to get a $0 copay. Remember, if your doctor's office is offering you a virtual appointment or a follow-up, that visit does not fit under this benefit. That means you would have to pay the same copay amount as your traditional in-person doctor visit instead of the $0 telehealth copay through Now Clinic. So something unique to our plan is Dispatch Health. This benefit offers same-day, in-home medical care to covered members. It allows patients to recover comfortably at home instead of driving to an urgent care. Dispatch Health services can be requested by calling 702-329-2093. Dispatch Health's medical team can treat nearly anything an emergency room can, so long as it's not life-threatening. After you receive care, Dispatch Health will call in any prescriptions you may need. You will need to receive your prescriptions the same way that you do now. And the most awesome part is Dispatch Health is available from 8 a.m. to 10 p.m., 7 days a week, and it includes all holidays. And your copay for this service is only $30 if you have the signature plan. And if you don't feel comfortable using that option, there's also the traditional freestanding urgent care centers that you can still use. In-network locations around Clark County are provided by UMC Quick Care and CareNow Quick Care. You can also find other options by visiting the Find a Provider link on our website and searching Quick Care as well. And for these services, for the signature plan, you're going to pay $30. And if you have the Advantage plan, you have to pay the full amount until you reach your deductible, after which the plan will pay 80% of the contracted rate. You can contact our THT UMR benefit team at 702-794-0272, option 1, to get more information on your cost. And if you're a CVS MinuteClinic fan, they're still available on the plan. You can access any CVS MinuteClinic in the U.S. for a $40 copay with the signature plan. If you have the Advantage plan, you have to reach your deductible, and then the plan will pay 80%. So lastly, a traditional visit to the emergency room, whether it be attached to the hospital or a freestanding emergency facility, is going to be the costliest of all healthcare. But in a true emergency situation, you should call 911 or get to the ER ASAP. Your copay on the signature plan, once you meet your deductible, is going to be $300 and 20% of all provider services while in the ER. If you have the Advantage plan, until your deductible is met, you will pay in full based on the contracted rate. So to help you navigate your medical needs, grab your phone and let's download the UMR app together. Download the free mobile app or open a new tab on your computer and create an account at umr.com. All you need to create your account is your member ID and the group number, which is 76414892. Once you have an account registered, you have most of the information that you're going to need to access your health care at your fingertips. So your copays, ID card, deductible, and the ability to find a doctor or facility, among other tools, are available wherever you have mobile service. So just a couple final thoughts here. First off, we have a couple more upcoming webinars. Those are all going to be posted on the website, and we're also going to be emailing them to you as we complete them. So here's information on how to contact us. And just as a reminder, we do stay on the webinar 15 minutes after it's completed to answer questions in our chat. And we appreciate you guys so much and what you do. Thank you so much for joining us today.